Welcome to the Hawaii Health Data Warehouse's monthly coffee break webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be exploring maps and geographies in hawaiihealthmatters.org and hhdw.org. Maps are important because they can help people visualize data and see geographic patterns. For example, epidemiologists can use maps to track the spread of disease. Ecologists can use maps to understand wildlife movement, and climate scientists can use maps to understand weather patterns. So first, we're going to look at hawaiihealthmatters.org, or HHM. So in HHM, most of the time when you click on an indicator, it will open to show you the state level data. So there is a map, but it's actually, all the same color. But if you click on the location option from the floating bar, you can change the geography, and then you'll see a color-coded map, chart, and data table for all of the units in that selected geography. The geographies that are available depend on the data source of the indicator. So we try to provide data at the most granular level possible, but not every data source is designed to be able to make estimates at small geographies. However, with some of the indicators in Hawaii Health Matters, you can actually get data all the way down to the census tract level. You can tell which geographies are available for an indicator by looking at the options in the drop-down menu for that location option. So here's an example of the percent of adults who smoked cigarettes in 2023 by zip code. What Hawaii Health Matters does is it ranks the zip codes into 5 groups based on their value, and then color codes them. So for this map, you can see the darker the blue, the higher percent of adults who smoke. And we'll take a closer look at a similar map during the demo. I also want to mention the Socio Needs Index in Hawaii Health Matters. So here you'll find maps that rank health equity, mental health, and food insecurity for the state. And the maps are available at the county, zip code, and census tract level. We do have a coffee break on how to use this index. So if you're interested in more detail, check our YouTube page and look for the Socio Needs Index coffee break. Okay, let's take a look. So here we have the Hawaii Health Matters homepage. You can see our usual updates. We do have links to additional information about using the site. But we're really interested in maps and geography today. So I'm going to start with our data trackers to kind of highlight these as well, because these are really good resources for particular health topic areas. So you can see here we have these 6 and then these 4. So let's take a look at the Child and Family Mental Health Tracker. Here you can see a little information about the tracker. It gives some links to important resources. And then we jump right into the data. You can see here for these trackers that shows you the most recent point estimate, and then also some comparison values to kind of help you put that data in context. But if you want to see more about a particular indicator, you can just click on it. So here we're going to look at teens with recent depression. And what we can see here is for the state of Hawaii for 2023, 34.9% of teens had recent depression. Well, what does that mean, really? Here you can see the actual definition. So this is public school students in grades 9 to 12 who felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities. And this happened in the past 12 months. So that's our definition. Again, you can see a little bit about why it's important. Here you can see our trend data. And then next is our geography. And I'm going to come back to this because right now it's just showing the state data, right? So it's all just one color. But I do want to also mention, for those of you who maybe aren't familiar, we do have data broken out by socio-demographic subgroups, which is really a great way to identify disparities. And then we also, the other nice thing about Hawaii Health Matters is it has a really good resource library. So with every indicator you're looking at, there's going to be links to a lot of additional resources. But let's go back to the geography. So I mentioned you can change the geography by using this floating bar here. So let's just say, let's look at this value from Maui County. So now what we're seeing is the data for Maui County, and we can see that it's lower than the US, it's lower than the state, but it too is worsening over time. Here we can see the trend data, and you can even get, depending on the sample size, you can get some population data even at the county level. But here we're interested in looking at the geography. So now we can see that we've got the 4 different counties, the 4 major counties, color coded based on their values. And so we can see also a chart here, and we can see that Honolulu County actually has the highest percent of teens with recent depression. Maui County has the lowest. There are some options here. For example, if you wanted to show the confidence intervals, there's also the table here, which you can download. Let's look at another example. So now I want to look at one of our new data trackers, the diabetes tracker. Again, we've got some good background information, links to helpful resources, and then we go right into the data. And in this case, let's just look at adults with diabetes. So here again, we're going to see the most recent point estimate. So 11.5% of adults, and for the definition, it says adults who have ever been diagnosed with diabetes. And again, these comparison values to kind of help you interpret the data. It's been stable, it is worsening over time. And we do have a diabetes plan target value that has not yet been met for the state. Okay, so now we'll scroll down. Again, you can see some trend data. And here we are with our geography. So this one I happen to know is available at the zip code level. So I'm going to pick the zip code for UH. And now what we're going to see again is the data just for that zip code. So we can see again, it's in the better half of the US. It's lower than the US value. And here we can see the map. So again, this shows all of the different zip codes ranked into 5 different groups. So the darker the color, the higher the value. And again, this is adults with diabetes. So you can really see in here, you can start to get a feel for some of the areas that have higher versus lower values. And you can take a screenshot of this map and use it if you need in any reports. And as I mentioned before, you can download this chart and also download this data. Okay, I mentioned another thing during the introduction, and that was about our socio-needs index. So this actually, it has 3 different indices, and you can see all 3 of them here. I got to that by going to find data. Let's take a look at the food insecurity index. So this is something that is created by the group that runs this platform, Conduit Healthy Communities Institute. What they've done is taken a selection of indicators that are correlated with, in this case, with poor food access. So then they create an index. They give every geographic unit a value between 1 and 100, and then they rank them between 1 and 5. And if you're interested in the nitty-gritty, you can click here and it'll give you all those details. But here what we can see now is a map by zip code for food insecurity, where the greatest need is the darkest color. So again, this is it's a really good tool to be able to look at smaller communities in the state. Here we can see it by census tract. And of course you can zoom in if you want to see, it's more detail of the census tracts in Oahu. And again, there's the chart and the data table. One last thing I do want to show you before we talk about HHDW, these data trackers are pretty cool because you can filter by geography here. So we're looking at this Healthy People 2030 Progress Tracker, which has indicators across a whole range of different health topics. But if we were interested, say, in Kauai County, right at the top of the tracker, we can select that geography. And now we're going to see all the data for Hawaii County. Now, some indicators may not have data at that level and they won't show up, but most of them do at the county level. So this is a really good way to see a kind of a snapshot of a particular community if you're interested. Okay, let's go back. And now I want to kind of shift to HHDW. So for those of you who are unfamiliar with hhtw.org, it houses data from these 5 data sources. And I wanted to let you know of these because the mapping function is a little different depending on the data source. So starting with our PRANS and YRBS, our pregnancy and youth surveys, both of these surveys, you can only get estimates at the state and county level. So when you're in HHDW, you'll actually choose your geography when you choose your indicator. And if you choose the county option here, a map will automatically appear with your query results. For HHDW and vital statistics, the default query is for these data sources, it does not produce a map because it's state level, but you can modify the query to select your geography of interest. And I'll show you where this is. It's in the last step where you do a display by option. So BRFIS is really, it's a large survey. And because of that, we're able to make estimates at some pretty granular geographic levels. So on hhcw.org, BRFIS data are available at the state, county, island, community, primary care service, and school complex levels. For our vital statistics, the geography depends on whether you're looking at results that are counts and percentages versus rates. So you'll see here for counts and percentages, we can offer infant birth location to island level and a mother's residence to the school complex level. For rates, we only have mother's residence at the state and county level. And this is because rates require denominators taken from population data. So if you want to know the birth rate per 1,000 females in Maui, you have to know how many females there are in Maui. This isn't too hard to do at the state and county level, but it definitely gets more complicated at smaller geographies. So our rates are available at the state and county level, whereas our counts and percentages, you can get a little more granular. For the death data, it's the same pattern. You can get down to the school complex level for counts and percentages, but we only have state and county data for rates. Our last data source is the Youth Tobacco Survey, and this actually is kind of a small survey, so we can only get estimates at the state level here. So there really aren't map options for the YTS data. So just to show you, here's a summary of the data sets that are available in HHDW, and here you can see the smallest geography available. Before we move to the demo, I just want to give you a little more information about some of those geographies that are offered in HHDW. So in addition to state, county, and island, we have the community level. So this consists of 24 units defined to have enough respondents to report data at the level. So it was developed by a working group at the Department of Health in 2000. And what they did was group up school complexes to make a sample size big enough so that we could actually report data. We also have the primary care service area, and this has 35 different units. These are based on census tracts, and they're selected to represent geographic approximations of markets for primary care service. So what this means is that each PCSA represents the geographic region from which a healthcare provider or facility, like a hospital or clinic, draws most of its patients. And then last, we have the school complex level, which is not the school complex area level. This is a school complex level is 39 units, and each unit includes a high school and all the elementary, middle, and intermediate schools that feed into it. So again, these are the geographies we have on HHDW, and let's take a look. Okay, so here we have the HHDW homepage. And again, we can see there's some links to our news and announcements and additional resources. If you're interested in other functions of this site, please check our YouTube channel. But for now, we're really interested in focusing on geography. So let's take a look first at our youth risk behavior survey. We are interested in building a custom YRBS report. You can see here we have some resources that can help you navigate all of the indicators that are available. And the YRBS is actually done in 2 different surveys, one for high school and one for middle school. So let's just take a look at high school. Let's look at general health and BMI. And let's take a look at overweight or obesity. And we're interested in looking at the county level data. So here you can see this is a default report for hhdw.org. It shows you the 3 most recent years of data, in this case grouped by county. So we can see here the different prevalence of overweight or obese teens. This is a nice example to show where you can sort the table and the chart to make it a little easier to see. And there is also a map. So this is very similar to HHM in that it color codes the different values. Since we only have data for the 4 major counties, there's actually only 4 colors. But you can see here, the darker the color is, the higher the prevalence of overweight and obesity. And this too, you can screenshot. Here again, you can download this data. Here too, you can copy this chart if you wanted to use it for a report. Let's take a look at another example. So let's go to our BRFSS data, which we know has actually more granularity. So we're going to build a custom BRFSS report. Here again, we've got some resources, tools to help you understand what's available and navigate it, find what you want to see. Let's take a look at chronic diseases and conditions. We're going to look at high blood pressure, and we're going to look at high blood pressure prevalence. We do have 2 different types of rates here. You can find out a little bit more about the differences using those question marks, or you can also check our YouTube channel and see other coffee breaks where we have addressed that. Okay, so here again, we have our default report for hhdw.org. So this shows us the 3 most recent years of data for the state by year. But we can modify the query here. So you'll see there are a lot of steps here, and you don't actually need to make any changes in these steps. The one that you really need to focus on is step 8. This is one where you're telling the system how you want to see the data. So here we are looking at high blood pressure prevalence. Let's look at it by community, and you can see right away that some map options pop up, so you can change the color scheme. And now when we see our results, we're going to see all the data for these 3 years aggregated by community. And again, here's a nice time that you can use the sort function just to really get a clear idea. And if you scroll below the data table, here's our map. So again, we can see that the darker colors correspond to the higher prevalence of blood pressure. And there's also, you can screenshot this or download the data table. Let's look at one more really quickly. I want to show you what the vital statistics looks like when you're looking at geographies. So we're going to use the birth data, and we're going to do a custom birth report. And let's take a look at one of the percentages. So remember, I mentioned that counts and percentages, you can get a lot more granular geography for those. For rates, and we have here our population rates, and these are our population rates by DOH race ethnicity. Those are only going to be at the state and county level. So let's take a look at one of these percentages. Let's look at the percent of mothers who initiated prenatal care in the first trimester. So again, here the default is going to be for the whole state, and it's going to show us the 3 most recent years of data, but we can modify this query. For vital statistics, since there are so many options for geography, you actually need to specify the geography that you want to see in step 1. So let's take a look at community. Now, when we go down here and we tell the system how we want to see the data, we say, oh, we want to see it by geographic area. And again, you'll see those map options come up. And here, now you can see this is the percent of mothers with prenatal care in their first trimester. And again, this is a great place to use our sort function. And then below our table 2, we will have our map. So here, the color coding is reversed because we want women to get prenatal care in their first trimester. So in this case, a high percentage is good. So those are the lighter colors. And when you get to the smaller percentages, it gets dark. So the same idea is, the darker the color is, the worse percentage. But just depending on what indicator you're looking at, it may be one way or the other. Okay, so let's go ahead. And now I want to give you a little time for some hands-on work. So take a few minutes and explore maps and geographies and why health matters in HHDW and answer these questions. Okay, let me go ahead. I'm going to go over these answers. So the first question was for HHM, what geographies are available for the indicator adults who are obese? So we're going to go to HHM. And one way that you can quickly find indicators based on what you're interested in is just to use this search bar up at the top. So I'm just going to put in obese. And here we're going to see adults who are obese. When you search this way, it will actually show you immediately all of the geographies that are available. So we can see here, this one is available: state, county, PCSA, census place, zip code, and census tract. Okay, the next question is for HHDW, and it asks true or false. PRAMS data can be viewed at the primary care service area level. So let's go to our PRAMS data, and we want to build a custom PRAMS report. And let's just look at any of them. And we can see automatically, oh, actually, no. So the PRAMS data, if you remember, is only available at the state and county level. So that the answer to that question is false. There is no PRAMS data at the primary care service area level. The last question asks about bullying among our high school students. So let's take a look at this. And so which county had the highest prevalence of electronic bullying among high schoolers? So here we're going to look at our high school data. I know that bullying is under injury and violence. We're interested in electronic bullying, and it's asking about our counties. So here we can see, and if we wanted to just make it really easy, we could sort, and we can see that Hawaii County at 14.9% has the highest rate of electronic bullying. Okay, here are the answers. I want to invite you to join us in June for our next coffee break webinar. So on June 2nd, we'll be discussing the 2024 Behavioral Risk Factors Surveillance System data release. So you may have noticed we did already release the 2024 data for BRFSS for all of our existing indicators, but this release will include all of the new indicators that we have made this year. So join us and see what's new. Thank you very much for joining us today. If you have any questions in the meantime, please contact us at profiles@hhdw.org. So thank you. We look forward to seeing you in June when we'll be looking at the 2024 BRFSS data. Mahalo and enjoy the rest of your day.